Hello everybody, I am Dr. Randeep Guleria. I am the Chairman of Internal Medicine, Respiratory and Sleep Medicine at Medanta, the Medicity, Gurugram. Today we will be talking about whooping cough. Whooping cough is a respiratory infection which affects the upper airways. It's predominantly infection occurring by a bacteria known as pertussis, and this causes infection in the throat and the upper airways. Usually starts with fever, running nose and followed by cough. Later on, when the cough becomes more intense, people start having violent bouts of cough, and when they cough, they also then take a deep breath in, which causes a whooping sound, and that is why the name whooping cough has come, because the cough becomes very troublesome, occurs more at night and causes a sound which is whooping in nature, and that's why the name whooping cough is used. In the early part of the illness, people have fever, there is running nose, pain in the throat and a mild cough. But over the next few days, 5 to 7 days, it progresses and the cough becomes more severe, starts becoming troublesome, and then people start having bouts of cough and pain in the throat, which becomes more and more spasmodic, and then that troubles them for some more time, about 7 to 10 days, and gradually then it starts improving. But in many people the cough can persist for weeks. It's not as severe as in the beginning, but persisting cough can last for a longer time. So you have three broad phases. The initial phase where there is fever, sore throat, running nose. Second phase where you have a lot of cough, the whooping cough, which is when a diagnosis is suspected. And the third phase when the cough continues to persist, when you are recovering from it, which is the convalescent phase. So it is a contagious disease caused by a bacteria, and therefore when people have the infection and they're coughing, the bacteria is passed on through what is known as droplet infection to other people, and it's passed on from human to human by this manner. There is no reservoir or other source of the infection in terms of animal or any other way where the bacteria can stay. So it is an infectious disease which spreads from one person to the other because of the cough, and the cough causing the bacteria to come into the environment in small droplets which get inhaled by another person, and that other person gets the infection. Whooping cough has a vaccination which is useful, and it's given in children also, and that is useful in terms of preventing the severity of illness and decreasing the symptoms. It's a part of the immunization program that is already there and is given to children in the young age group. There's also the issue of now giving the vaccine to older age groups, especially people have not got it, or also giving it in the elderly as a part of booster to prevent them from getting more severe infection. The treatment for whooping cough is predominantly symptomatic. So you give symptomatic treatment in the form of anti-allergic, and you give symptomatic treatment for cough. Sometimes antibiotics known as macrolides like clarithromycin or erythromycin is also given, but by and large it's a self-limiting disease. You give symptomatic treatment and people recover on their own. You have to be a little careful because sometimes this can lead to secondary bacterial infection going into the lungs, leading to a secondary pneumonia. There can be uncommon complications also like encephalitis because of severe coughing and low oxygenation. So if one is having severe cough, close monitoring is required so that complications don't occur. But the primary disease is usually self-limiting and becomes alright with symptomatic treatment. So like we say that in anyone who has a respiratory infection which is infectious, one should isolate himself, make sure that for at least 7 days or so does not come in close contact with another person who can get the infection, especially children or the older age group, people whose immunity is low. Ideally, one should wear a mask so that the infection is not getting transmitted. If you're coughing a lot, use a tissue so that your cough is contained, or cough into your armpit so that you're not transmitting the bacteria into the environment. Regularly wash your hands. Hand washing is also a very important issue. So it's important to isolate yourself so that you don't spread the infection to your relatives or friends, and at the same time follow cough etiquettes and regularly wash your hands.